Hi, welcome to this session on Fluid Immersion Simulation and clinicians' experiences of it. My name's Debbie and I'm Clinical Director at Medstrom. At Medstrom, we are really passionate about making sure that any claims made about products are underpinned by clinical evidence. I myself am undertaking a master's degree at Sheffield University in clinical research so I can further enhance our provision of clinical evidence and the messages that we use about our products. We know, however, that if you're considering using a product, you don't just want to have clinical evidence, you want to know how products actually work in clinical practice. So unfortunately, because of COVID at the moment, we're not able to bring clinicians directly to you. They're both busy in clinical practice and restrictions mean that we can't do this for you. So we've done the next best thing, and we have previously recorded conversations with clinicians who are testifying to the difference that fluid immersion simulation has made to them in their practice and their patients. So the first patient placement of Dolphin was in 2012, and ever since that first placement we have collected clinical outcomes and we now have over 1,000 patient sample that can help us to testify to the results that Dolphin therapy provides patients who are highly complex and in need of therapy. For anybody who hasn't had experience of using or exposure to air fluidization and fluid immersion simulation, just have a very brief overview so that visually we can show you what these therapies do. The first of these is air fluidization therapy. So the reason that air fluidization is so beneficial for patients is it literally creates an artificial fluid environment upon which the patient becomes buoyant in. So if we use this apple, we can see that when the air starts to blow through these silicone beads, you can see by this surface it creates an artificial fluid. So the patient, when they're nursed upon this surface, becomes buoyant. This means that soft tissue is not compressed and perfusion is much easier to achieve. If we put the apple in, we can see it become completely buoyant. So another way that we can show fluid simulation and why it makes such a difference to tissues is very quickly using this fishbowl and tissue sample. So if we use this as an example of a cell or a group of cells, when we lie on a surface, both weight, our own weight, and gravity presses down on the soft tissue or the cell. Over time, loading a cell for a prolonged period of time or heavy loading of a cell can cause the cell structure to be damaged. When that happens, all the cells around the cell that is damaged then have to bear the weight that that cell would have been sharing for a structure around them. This can cause an inflammatory response. So the compression of the soft tissue, in addition to the inflammatory response, means that there's less perfusion to the cells, and that can over time lead to ischemia and tissue damage. By comparison, when we have a cell or a tissue in a fluid medium, you can see that the structure of the cell or the cells remains fully patent. It hasn't been compressed by weight or gravity, which means there is no damage to the cell, there's no ischemic changes, and there's great perfusion to that structure. So now we're going to let some of the clinicians talk to you about their own experiences using Dolphin fluid immersion simulation therapy within their patient group. The first of these is Julie Tyra, who is a tissue viability nurse consultant in Liverpool Heart and Chest. It's their protocol to use Dolphin therapy where patients are having heart or lung transplant surgeries and are on the operating theatre table for upward of 16 hours. Post-surgery, many of these patients are left open chest so that they may not be repositioned for 48 hours following this surgery. I hope that you find her experience useful.
Hello, my name is Julie Tyra. I'm Tissue Viability Nurse Consultant, and this is Sammy Mills, Tissue Viability Specialist Nurse. We've been using dolphin mattresses here for about 4 years. I still remember the first patient who we conducted an evaluation of the mattress with. I remember her for many reasons. She was a young woman. She'd had an aortic dissection, so she was on the theatre table for about 36 hours. When she came off the theatre table, she went straight onto the dolphin mattress, and she was still very unstable and could be repositioned for many hours afterwards. When her skin was first inspected, there was some tissue damage, but there was a lot less than I expected there to be. Previous patients who'd been in the same situation on the theatre table for the same length of time, we'd seen deep tissue damage that progressed to unstageable pressure ulcers. So a pleasant surprise, and as a result of that one evaluation, we decided to incorporate the dolphin mattress into our mattress selection criteria.
My background is a tissue viability nurse for 2 years, but previous to that I was an intensive care nurse. So I saw a massive change when the dolphin came into effect. We saw a reduction in pressure ulcers, patient skin was a lot better. Tissue damage obviously reduced as well, and it was quite an easy product to use as well, so the transition was easy.
So we worked with our theatre staff and our critical care staff in particular in developing our own patient selection criteria. The length of time the patient's on the theatre table, whether or not they have multiple bony prominences, their cardiovascular status, and to predict that the patient's repositioning is going to be limited post-op. That patient selection criteria is utilised very well with our theatre staff in particular, and we have assurance that our riskiest patients are transferred directly from the theatre table at the earliest opportunity, and as a result of that we see benefits for our patients.
As a sister on intensive care, when we first started using the dolphins, it was always a relief to find that when a patient hadn't been able to be rolled for 3 days, that we were doing a dolphin mattress, so it wasn't as scary when you rolled them. You knew you weren't going to get a really scary surprise when you did that, so that's why I use them.
We were able to demonstrate quite easily a cost benefit of incorporating dolphin mattress into our mattress selection. We use the Department of Health Productivity calculator, and by entering your pressure ulcer incidence by category, it will calculate the financial cost of those pressure ulcers to an organisation. This was in no way comparable to the expense that our hire of dolphin mattresses was going to incorporate. We'd have no hesitation in recommending the dolphin mattress to move forward, do an evaluation, just to see if they can improve outcomes for you, as they have done for us.
So the next clinician that you'll hear from is Lauren O'Leary. She works in Ibuthon Specialist Palliative Care Unit. In this environment with end-of-life patients, it's especially important that patients in their final hours are kept comfortable and as pain-free as can be. If you imagine being nursed in a fluid environment, these are the type of experiences that Lauren will tell you about.
My name is Lauren O'Leary and I'm Deputy Ward Manager of Ibuthon Palliative Care Unit. We're an 8-bedded unit. We provide specialist palliative care for patients with malignant and non-malignant conditions, or for end-of-life care. Because it's a new facility, obviously, it was purposely built for us. We wanted to keep the homely feel and the comfortable feel, because it was a cottage hospital, quite a relaxed atmosphere. It didn't feel clinical in any way. And it's about making the patient feel at home, really, so home from home at the most difficult time in their lives and their families, and if we can make that as comfortable as possible, we're doing a good job. Every patient is obviously assessed on admission. If any patients develop any pressure areas, we always refer to tissue viability, and they can come and assess the patient and advise us on as to what equipment is needed because as you can imagine, patients, we have a high risk of developing pressure areas. If we need to change any, we always look to tissue viability for advice, and they will advise us then on using alternative equipment such as the dolphin mattress. Recently had a gentleman with sort of complex disease and spine metastases who found it very difficult to reposition in the bed due to increased pain, incontinence, decreased mobility, and obviously just due to disease. So due to us being unable to reposition him regularly, we contacted Tissue Viability for advice, and they advised on the dolphin mattress, which has been a godsend for this patient's care. The patient used the dolphin for approximately 6 weeks, and the feedback from the patient was very positive due to comfort, and also due to him not having pressure areas, which could have been a massive risk as he had lots of other complications. Due to the fact that we were unable to reposition him as regularly as we could due to increased pain, just the general comfort of the mattress, where he didn't feel the cells alternating and causing extra pressure or extra discomfort. He explained that he felt like he was on water. We found using the mattress very easy. We received training how to use the mattress, what the alarms meant, the purpose of the mattress, how the mattress worked, which we then cascaded through the team so everybody was aware of how it was. And we had regular visits from the company coming to check that it was still working okay, that we were finding it beneficial, and if there was any problems, which we were very grateful for. The team felt that it took a little bit more pressure off them because we felt we weren't able to provide adequate care for him appropriately due to his increased pain, or as often as we would like to. I think we felt a little bit more at ease knowing that he was on the correct equipment and that he was helping his pressure relief. Definitely, yeah. I think, as I explained with the patients, that it's been quite difficult to reposition, whether it be due to pain, just general deterioration of their condition. It just gives that extra support and reassurance to staff that they can be left that a bit longer, or they can, the care is being provided even if it's not hands-on, it's via a piece of equipment.
So as well as hearing the experiences of clinicians who have used dolphin simulation in their practice, dolphin therapy, unlike many services in the UK, has 1,000 patient outcomes which testify to the type of experience you can expect should you choose to use dolphin therapy.
first experience of dolphin therapy was for a gentleman who developed an unstageable pressure ulcer prior to admission due to a fall and a long time spent on the floor. Unfortunately, due to his trauma, he had to be in traction for an elongated period of time and repositioning was difficult. A higher specification of mattress was required as the pressure ulcer was deteriorating. After such a positive experience of dolphin therapy, it has been added into our selection process on an ad hoc basis if this kind of situation arises again. The response and the support from Medstrom is excellent. After implementing dolphin therapy, the pressure ulcer improved even though the repositioning regime did not change. Dolphin therapy was reported to be comfortable by the patient and it did exactly what it is advertised to do.
I hope that this brief overview of this classification of mattress has been of use, and especially that you've enjoyed listening to the experiences of the clinicians who have used these products in practice has been a good use of your time. We have a team of over 13 nurses and many other members of the multidisciplinary team who would love to take this conversation further with you if you feel that it is of interest to you. Please get in contact with us. We'd love to share further evidence and testimonies with you.